Disclaimer: before judging this video or giving away your feedback, we would like to inform you that majority of the members of this video were vaccinated. Non-vaccinated personnel used their face shields voluntarily. There was also 10 maximum members that were allowed in a specific scene. Also, each members were not showing any signs or symptoms of COVID-19. So what are you waiting for? Get vaccinated now para makabalik eskwela na.
Hi, I'm James Schrecker and this is my team, and we are going to teach you some rescue tips in case of an emergency. Because we are
The Rescue Mission Team!
First, CPR. We use CPR when someone has collapsed and is not breathing. By CPR, it can keep people alive until emergency service arrives. Learning the simple life-saving skills is as easy as ABC. All you have to remember is the doctor's ABC. D is for danger. First, look around carefully to make sure that the area is safe for yourself and others before approaching. R is for response. Shake them gently by the shoulder and ask him or her loudly, "Are you alright?" If there is no response, then we proceed to S. Shout for help, as any assistance will be helpful. A is for airway. Gently tilt the head back to open up the airway. B is for breathing. Look, listen, and feel for signs of normal breathing. Look for normal chest movement, listen for normal breathing sounds, and try to feel your breath against your face. Do this for no more than 10 seconds. If there is no sign of breathing, or if he or she is breathing in an unusual, noisy way, we need to start CPR. First, make sure the ambulance is on its way. If you or someone else is with you, ask them to make the call. Putting the phone on speaker mode is useful as the ambulance service can talk you through the steps. C is for circulation. Circulation means the flow of blood around the body. And when the heart stops pumping, we need to take over this role by pushing down hard and fast on the chest. Start by placing the heel of one hand at the center of the person's chest and interlock your fingers. With arms straightened, press down hard and fast, letting the chest come back up fully each time. Fast means around 2 times every second, and hard means that the chest needs to go down by about 5 centimeters. If someone else is with you, swap over. If you begin to feel tired, don't stop until either a health professional takes over or the person is definitely breathing normally. Next is dealing with electric shock. Electric causes burns via the flow of electric voltage through the skin, but electric shock can cause more than burns. It can cause tissue damage, and extremely high voltages may even stop heartbeat. Steps in handling emergencies involving electric shock. Don't waste time to switch off or remove plugs immediately. Switch off the master fuse to turn off all the power. These are things you can do to help without injuring yourself. Stand on a thick pile of newspaper or a rubber mat if the ground is wet. Wetness makes you a conductor of electricity regardless of what you are standing on. Try to push the injured off the live wire by using a wooden broom, mop, or pole. Your hands must be dry. Treating for electric shock before help arrives. Because shock is more of a risk with electricity than other types of burn, check the injured person's ABC, airways, breathing, and circulation. And take the appropriate measures. If the person is not breathing, immediately begin mouth-to-mouth resuscitation. Apply small amount of antibacterial or burn ointment on the burned skin. Keep the injured person on his or her back with his or her feet and legs elevated. If the injured person is unconscious, gently turn him or her to the side, supporting head with a pillow. This will aid breathing and keep shock damage from increasing. Gently cover the injured person with a blanket. Next is animal bites. Can be extremely dangerous if unchecked. Therefore, it is necessary to be able to treat the infected area as quickly as possible. The most important thing that needs to be done is to evaluate the bite area. Subsequently, if the wound is deep, you must stop the bleeding immediately. If necessary, lift the afflicted region and gently press with a cold, clean towel until the bleeding slows or stops, because cold helps blood vessels contract. Putting an ice pack or anything that is cold enough in a towel before applying it might speed up blood coagulation and prevent bruising to the area. Finally, cleaning the bite area. The most important aspect of treating a bite is to prevent infection. Thoroughly wash the bite with warm water and soap. Allow warm water to flow over for 5 minutes to wash out any bacteria. Then apply an antibacterial ointment and a sterile dressing to the wound. Next is fainting. Fainting is when someone briefly becomes unresponsive because there is not enough blood flowing to the brain. People often faint and the warning signs are sudden paleness of the face, cold, dizziness, numbness, weak pulse, the feeling of panic, and blurred vision. Now, what should you do when someone faints? Number 1. Lay the person down on the floor on his back. Number 2. Practice your ABC of first aid. Make sure that the airways are clear, that the person is breathing, and the blood is circulating. Number 3. Loosen clothing if necessary to make sure that the victim is comfortable and able to breathe clearly. Number 4. Keep up the chin to prevent the victim's tongue from obstructing the throat. 5. If the victim remains unconscious or conscious but groggy, disoriented, it is best to call for emergency help. Someone who has fainted will usually recover quickly because it's normal to feel a bit weak after fainting. Be sure that the person stays lying down for a bit. Getting up too soon may bring another fainting spell. This is James Schrecker, and that was my team. We are the Rescue Mission Team.